Well, good afternoon, everyone, and welcome to our October webinar. We're excited to have all of you here today. I am Andrew McGill, a wealth advisor here at 12 Points. This afternoon, we are excited to have Steve Gilbert joining us. Before I turn it over to Steve, just want to give you a little brief background on Steve. Steve has a broad depth of experience that comes from over 25 years of service in the financial services industry. And as part of Prudential Annuities Advanced Planning and Solutions team, Steve works extensively with financial professionals, CPAs, and attorneys, aiding them with complexities and opportunities of retirement planning, income distribution, and estate planning. And today, as you can see on the screen here, we'll specifically be talking about maximizing Social Security and managing healthcare costs in retirement. If you have any questions along the way, feel free to throw your questions in the chat and I'll be monitoring it while Steve is talking. This webinar will be recorded, so if anyone has to leave early or knows someone that might wanted to be on this and was not able to attend, we'll be sending that out afterwards. So with that, thank you again, Steve, for joining us. I'll turn it over to you.
Great. Thank you, Andrew, and good afternoon, everybody. Definitely glad to spend a little bit of time with you here today. I just wanted you to know, and you're probably aware of this, that when you work with 12-Point Retirement Advisors, you're obviously working with a team that has a ton of resources at their fingertips. We just happen to be one small insurance company they work with named Prudential. And my group is just one group of folks that they partner with. And we're the advanced planning group here at Prudential. We're about 20 strong. About a third of us are attorneys. The other third are CPAs. The other third are CFP types like myself. And we're dedicated with working with the advisor community. And every once in a while, lucky enough to work with their partners in talking about issues ranging anywhere from gift and estate tax, income tax, the topics of today, Social Security and healthcare, and certainly most of the trust business comes through our area. So I just want you to know that when you work with this group, you're working with a team that has a ton of resources at their fingertips. We're just one of them. So today we're going to cover a little bit on Social Security and healthcare and retirement, two massive government programs heavily involved in the process of retirement. So this is a nice opportunity for a couple of reasons. One, the stuff is changing on a regular basis. It's always very important to make sure that we're aware of where these programs stand today. This is not something that the Social Security Administration is going to provide you, that the Center for Medicare and Medicaid Services is going to provide you. They just don't come out and provide information along these lines. And the bottom line is, if you have a retirement income plan that has not addressed how to plan for Social Security and how to plan for healthcare and retirement, it's just not a complete retirement income plan. You're missing a huge piece of the puzzle. And the bottom line is the difference between doing an optimal plan when it comes to these programs and doing something suboptimal can be a real significant difference in your overall retirement. So let's go ahead and get started. You'll notice that there are a few disclosure slides. We do want to make sure that you understand that what it boils down to is we're here to provide you information regarding Social Security and healthcare. We do not want anybody to come away thinking that they figured this out by a simple 45-minute call. There is no cookie cutter, one answer fits everybody kind of situation really in anything we do in our industry, and that certainly goes for Social Security and healthcare. So let's just talk about the future of Social Security, and we're not going to harp on this because obviously the media is doing a pretty good job of kind of letting us know where Social Security stands, and we all know that it is projected to deplete. Right now, the combined Social Security and Disability Trust Fund is projected to deplete in 2035, and at that point, there would be about 80% of the tax revenue required to pay out benefits. Now, is this something that can be addressed? Is this something that can be fixed? And the short answer is yes. We just need the fortitude to make some of these decisions. So if you take a look at Social Security, how is it funded? And it doesn't take long for us to figure that out. Just go look at your pay stubs. You'll figure it out real quick. It is funded predominantly through payroll tax. About 6.2% of our payroll goes off to Social Security, and that's the predominant funding source for Social Security. So obviously, one way to shore up Social Security would be to increase taxation. So that's certainly one way to do it. They've done studies where they increase taxes by 1%, and take a look at what 2% would do. And to be quite honest, it barely puts a dent in this whole insolvency issue with Social Security. Now, what is interesting is there is a thing called the Social Security taxable wage base. What it boils down to is, 6.2% of our payroll goes off to Social Security, but not necessarily for every dime we earn. There is a point where that Social Security payroll tax stops at about $147,000 of income. By the time we get to about $147,000 of income, we actually stop paying the 6.2%. So they've done some research. And, well, what if we did something with that? What if we got rid of the Social Security taxable wage base and just said, hey, folks, you're going to pay tax regardless of how much income you earn? And to be quite honest, that is a pretty significant impact to Social Security, provides many, many more years of solvency. So it may be part of the overall solution. And a matter of fact, I've been paying attention to proposed legislation. It has been in several pieces of proposed legislation, just of course hasn't passed yet. Other suggestions that are make it means tested. Don't take this the wrong way. It's already means tested. What they're saying is they would like to make it further means tested to try to shore up the solvency issue. But they also could slow money going out. So instead of dealing with the money inside the tax side, they could deal with slowing benefits going out. And they have proposed this in the past. One thing that they can do is adjust how our COLA works, how our inflation adjustment works. Now, on a side note, obviously with inflation the way it is right now, we are looking at a potential very significant inflation adjustment or COLA adjustment for next year. They're not done running numbers quite yet, but very well could be in the 9% range. So keep an eye out for that. But the bottom line is Social Security a lot of times is one of the few sources of income in retirement that is indeed adjusted for inflation. And they can change this. And they've done some of this already in the tax system, going to something they call chain CPI. Essentially, at the end of the day, it's a lower inflation measure. And they could do something like that in Social Security, making our inflation adjustments a little less aggressive. And then they also could just keep increasing retirement age. Some of you might remember that full retirement age for Social Security used to be 65. For those that have been retiring lately, it's been around 66. For those born after 1960, it's 67. So they can keep pushing the age out, and that's certainly part of the equation as we all tend to live longer. And one other thing that's been proposed is, and we'll talk about this in a minute, when they go to calculate your benefits, they base your benefits upon your best 35 years of earnings. For some who may not have 35 years of earnings, that invites some zeros into the calculation. They could make it worse and say, well, we're going to base it upon your best 40 years of wage history, which obviously makes it much more likely that some of those zeros will slip into the calculation. So anyways, we all know that the Social Security Trust Fund is not on the footing that we'd like. Can they fix it? The answer is yes. It'll probably take a combination of these items to truly shore up the Social Security Trust Fund. So let's go ahead and take a look at the next slide here. And we'll just talk a little bit about inflation adjustments. This is what inflation looked like last year, or really for this year. The inflation adjustment for this year was pretty significant in its own right. We saw a 5.9% increase, which, as was mentioned earlier, created a Social Security taxable wage base of about $147,000. Again, that's when you stop paying Social Security payroll tax. A couple other things that we'll bring up real quickly before we get into the meat of Social Security and then move into healthcare, is that there are a couple of very popular programs that we used in the past that just aren't really viable anymore. So there was a very nice strategy called File and Suspend that really hasn't been available to us since 2016. Now, another strategy called Restricted Application actually is still available. It's almost gone. But what happened is the Bipartisan Budget Act 2015, said, look, this is a little too good to be true, and curtailed what we can do when it comes to both file and suspend and restricted applications. Now, I'll just say this, because a lot of times when I'm talking to a group, and particularly when I'm doing it live, I'll bring up the idea of restricted application, and it is available. It's available to those who might be turning 69 by the end of this year, and it is a powerful strategy. So I always bring it up just in case there's someone in the audience that might be turning 69 by the end of this year. That is a very big reason to get together with your advisor to talk about your Social Security planning, and particularly talk about restricted application and whether that makes sense given your age. Now let's move to the next slide. We're going to talk about how benefits are determined, and it's kind of just the soup to nuts, the very, very basics of Social Security. So, one question we get asked is, well, how do you become eligible for Social Security? And the answer is, it doesn't really take a heck of a lot. All it really takes is what Social Security would call 40 quarters of wages, or if you want to talk in more human speech, it takes 10 years. You work for 10 years and get those 40 quarters, you're eligible for Social Security. So as you can see, the bar is not high to become eligible for Social Security. However, that is not what your Social Security calculation is based on. If you take a look at the right-hand side of the slide, you'll see that the calculation, instead of being based upon 40 quarters or 10 years, as was mentioned earlier, it's based upon your best 35 years of earnings. So what I was alluding to earlier is, let's say you're retiring a little bit early, maybe you started your career a little bit late, and you're filing for Social Security, and you don't have 35 years of wage history. Maybe you have, we'll just make it easy and say 30. Well, what happens? And I'd love to tell you that, oh, it's okay, they're going to take the 30 years and they're going to average those, but that's not actually how it works. Social Security has 35 years that they want to record into this calculation. If you can only see fit to fill 30 of the 35 slots, they will fill those other 5 slots in with zeros. Obviously, that is not a favorable scenario in an averaging calculation. It's popular, but sometimes as advisors, we have to suggest to the client, well, can we maybe work another couple of years? One, to try to get rid of a couple of these zeros in Social Security calculations. 2, give you a couple more years to save up for retirement. 3, give you a few less years that you got to supply income in retirement from your assets. So that's a little bit about how you become eligible, and loosely, very, very basically, how it's calculated. If we go to the next slide, we'll talk a little bit about full retirement. Another important thing to understand about Social Security is when you can receive all of it, when you get everything that you're due. And Social Security calls that your full retirement age. And as I mentioned, back years ago, it used to be 65. For many of those who've been retiring in the last few years, it's 66. As you can see, looking at the slide, those born between 1943 and 1954, when can they receive 100% of their benefits? What's their full retirement age? And you can see it's age 66. Now all those folks are 66 by now. So what happens is for every year after 1954, you simply add on 2 months. So simply, if you're born 1 year later, you're born 1955, your full retirement age is 66. It's 66 plus those 2 months. Obviously, you keep doing that. By the time you get to 1960, you've added a full 12 months. So as you can see, if you look at the bottom of the page, if you're born 1960 or later, your full retirement age isn't 65. It's not 66. It's not 66 plus whatever number of months. By the time you reach the 1960 or later as your year of birth, full retirement age is 67. This is what I mean. They keep pushing out full retirement age. They keep pushing out when you can get 100% of your benefits. And that might make sense given the fact that we're living longer as a society. Now, if we move to the next slide, we're going to talk a little bit about, hey, great, that's your full retirement age. That's when you can receive everything. You don't have to wait till then. You could take your benefits earlier. And a matter of fact, the most popular claim age in the Social Security system is the earliest possible, age 62. Age 62 is the earliest you can claim your own benefit. But for that matter, if you happen to be claiming off your spouse's record, a spousal benefit. Now, really what it boils down to is if you take it at 62, There is a reduction. It's not a free lunch. Not that you get everything at 62. There is a reduction. And a matter of fact, what we'll focus on is that right-hand side of the screen where full retirement age is 67. Because if you think about it for a minute, if you're full retirement age 66, you can't file early. You're already above full retirement age. So if you focus on folks that are full retirement age 67, those again that are born after 1960, you could see, looking at the slide, you could take it at 62 and that's fine. Just be ready to experience a 30% reduction in your benefits. Now, obviously, the reduction becomes a little less harsh the closer you get to your full retirement age of 67. Obviously, once you reach your full retirement age, there is no more reduction, and you can receive 100% of your benefits at your full retirement age. Now, on the flip side, take a look at this next slide. It talks about the advantage of delaying your benefits. So what do we know so far? We know that our full retirement age is when we receive everything. We know that we don't have to wait. We can take it at age 62, but we got to factor in this reduction. And you also have to worry about what's going on with work, and I'll talk about that in a minute. But on the flip side, you can actually delay taking your Social Security benefits beyond your full retirement age. And you might be thinking, well, why? Why'd you do that? And the answer is some might be interested in an 8% increase. And that's what happens. That's what happens. For every year you delay beyond your full retirement age, your benefit will increase by 8%. So, again, if your full retirement age is 66, they only do this increase until age 70. So there's 4 chances, right? 66 to 70. There's 4 chances at an 8% increase. So if your full retirement age is 66, that's a potential 32% increase that you might be able to take advantage of. Now, obviously, if you're a little bit younger, born 1960 or later, have a full retirement age of 67, then there's only 3 years, obviously, until you turn age 70. That's a potential opportunity to increase your benefits by 24%. Either way, whether you're at 24 or 32 or somewhere in between, that can represent a significant increase. And if you play that out over a lifetime, if not 2, that can make a substantial difference for some when it comes to providing the maximum benefit from Social Security. Now, that's great. That's a bunch of data points. But if you look at the next slide, we're going to take a look at what we call break even. And so it's great to know that you can take benefits at age 62, but hey, you got to contemplate the reduction. You can take it at full retirement age. You don't suffer a reduction. You get 100% of your benefits. And oh, by the way, you can wait to age 70 and get these 8% pay raises. All important and good to know. But it doesn't really frame up the issue. It doesn't really frame up what might be best for some. And what we're going to do is we're just going to kind of go through this break-even slide to give you not an answer for you, but kind of a generic way of kind of framing up the Social Security decision. So let's go ahead and set this up. We're talking about as simple as a case as possible, just to make it digestible. We're talking about someone who has a full retirement age of 67, and we know their benefit at age 67, so the full benefit is $2,000. But we also know they can take a reduction. They can take it at 62 if they want, and that would reduce their check to about $1,400. And then on the flip side, we know they age 70, they get the 24% increase, and they'd be looking at more like $2,480. But that's kind of it, right? For this very simple case, this individual can choose between all the way from taking $1,400 at 62 to $2,480 at age 70. But none of that really tells you what might be best. So what we're going to start doing is start looking at these break-even points. And what we'll start with is kind of the two ends. You kind of follow that blue break-even. What it says is, look, what we're comparing is the $1,400 decision at 62 versus the $2,480 decision at age 70. Now, look, we all get it. $2,480 is a lot bigger than $1,400, but there's a problem. I would have been collecting that $1,400 since I was 62 all the way to age 70. So let's not finish the conversation with that $2,480 higher than $1,400. We need to account for the fact that I gave up those $1,400 checks for several years. I'm in the hole, to be honest. So when do I make up for the difference? When do I dig myself out of that hole? And as you can see, the break-even point for that is about age 78. So a little less than a decade later, you've now made up for the checks you didn't receive and now have a higher check from Social Security, adjusted for inflation, and ready to be paid over your lifetime, if not your lifetime and your spouse's. Now we can look at a different break-even. We could look at maybe just 62 and 67. There's someone not interested in the 8% pay raises. That's never going to push it beyond age 67, their full retirement age. And as you can see, you're comparing the $1,400 check at age 62 versus the $2,000 check at age 67. That the break-even point's about 76. Again, just a year shy or so of a decade. Again, at the end, assuming you make the age 76, you now have made up for the checks you didn't cash all those years and have a higher check available to you, further yet adjusted for inflation and payable for life. Now, the last thing we'll look at here is kind of that gold slide there, or the gold break-even point, and that's comparing someone that is just looking at the full retirement benefit of $2,000 at 67 versus the $2,480 at age 70. And there you can see the break-even point's about age 81, so a little over a decade. Now, the important thing to understand here is if you look at all of that, break-even points range from 76 to 78 to age 81. Well, if you look at average life expectancy in this country, and you take a 65-year-old couple, it's estimated that there's a 50-50 chance one in that 65-year-old couple will make it out to age 93. So that just gives you a little bit of perspective that for many Americans, actually most Americans, delaying Social Security probably makes some pretty good sense. That being said, is it an answer for anybody on the phone here today? No, we don't know. We need to know you a lot better before trying to determine whether that's the right decision for you. We're just trying to give you some framework in which to think about your Social Security decision. A couple just add-on things here. First of all, why would someone only compare 67 to 70 and never consider 62? Understand that if you take Social Security benefits before your full retirement age, you could have an issue with your wages. Essentially, when Social Security sends out a Social Security retirement check, they expect you to be retired. If you're not full retirement age, they'll start reducing your Social Security benefits. So taking benefits early, it's not just about, I got to figure out what this reduction does, but it's also, we have to figure out what's going on at work, because if I make too much at work, I could have my Social Security benefits reduced. And then the other consideration is taxation. Is Social Security taxed? And it's kind of a trick question. There are Americans where Social Security isn't taxed just because they have variable levels of income. For most of our clients, they're never going to pay 100 cents on a dollar. The Social Security never is 100 cents on a dollar tax. But Social Security at its maximum is taxed 85 cents on a dollar. It's never 100 cents on the dollar tax. And what that leads to is a decision regarding what kind of tax picture we want to create in retirement. If I can create a strategy where I reduce distributions out of qualified accounts, increase distributions out of Social Security, I may be trading off 100 cents on a dollar tax dollar for an 85 cents on a dollar tax. So there's a tax angle here. And then the last thing I'll bring up is, obviously, this is an extremely simplistic example. Doesn't bring any of the complications that actual life brings. But let's just say that for a moment it's a married couple. The thing that we need to understand is that if we're dealing with the higher earner of a married couple, that income is not going to be just a lifetime income, but it's a joint lifetime income. Because there's an opportunity for every bit of that individual Social Security benefit to carry over to the surviving spouse. It's important to perceive it that way. I open up the door, so let's go ahead and turn to the next slide. We'll talk about spousal benefits. And when it comes to spousal benefits, essentially the clearest way I could describe this is, imagine someone that doesn't even have the 40 quarters we talked about earlier. They wouldn't be eligible for Social Security, but by pure nature of marriage to someone that is eligible for Social Security, that creates the eligibility. So marriage can create eligibility for Social Security. And if they don't have the 40 quarters, but they are married to someone that is eligible for Social Security, then they can collect a spousal benefit. A couple things to understand about spousal benefits. The maximum you're ever going to get on a spousal benefit is 50%. 50% of the working spouse's primary insurance amount. I understand you can take it early. You can take it early at age 62. You're not just going to get half. You're going to get a reduced amount. But the maximum is 50%. Now, if we change the situation and paint an unfortunate picture where you have a married individual, but one of the spouses dies, you're not talking spousal anymore. What you're talking is the buyer benefit. And the first thing I want you to kind of gravitate to is we're not talking half anymore. Now we're talking 100%. So a surviving spouse who was at least full retirement age, it isn't 50, they can collect up to 100% of the spouse's benefit. And of the spouse's benefit, that verbiage is important, because what that means is someone could have maybe delayed out to age 70, grew their benefit to the highest point possible, maybe even died at age 71, so you would think that was a bad decision. But what we need to understand is every bit of the increase they created is available to the surviving spouse. So that increase is carried over to that surviving spouse. Now, sometimes we get the question of, well, hold on, when is this first available? And you'll notice it's available a little bit earlier. It's available at age 60. So survivor benefits, instead of being 62, is available at age 60. Now, sometimes we get the question, well, wait a minute, I'm not 60. Telling me that there's no benefit for me. And that's not quite true. The next question to ask is, okay, you're not 60, you're not eligible for the standard survivor benefit, but do you have kids in the home? And if you do, and if you're under age 16, then you're able to benefit. And the most important thing to understand, and too many Americans aren't aware, is you do have an ability to switch between your personal benefits and survivor benefits. You normally cannot do that. And what that means is you can create a scenario where you can create the optimal distribution from Social Security by making sure that you claim the ancillary benefit later in life. Now, one of the questions that we get all the time, because I guess the divorce rate in this country is about 50%, is can I collect off the X? So we're going to look at the spousal survivor benefit. This is particularly in relationship to ex-spouses. So, if my ex is alive, can I claim off of their work record? And the answer is yes, but you got to qualify. The first thing is you got to get through 10 years of marriage. Maybe the lesson is you're 9.5 years, no bad marriage. Just stick it out, get to the 10 years, and at least maybe you can collect the Social Security. So you need 10 years of marriage. You can't be remarried. And if you're remarried to another guy or gal, Social Security is going to expect you to claim off of them, not your ex. And then you need to be entitled. Essentially means that you both have to be age 62. So as long as your marriage was for 10 years, you're not remarried, and you're both age 62, then yes, you have an ability to claim off the ex-spouse. Now, if we change this scenario and say, no, that spouse isn't alive, the ex-spouse is deceased. So we're talking about survivor benefits. Pretty much the same rules. You still have to be married for 10 years. So, again, get to that 10-year point. And then you'll notice that you only need to be age 60, but we know that survivor benefits are available at age 60. And then you'll notice that you cannot be remarried until over age 60. So that's a difference, right? When we're talking spousal benefits and everybody's alive, you just can't be remarried. When it comes to survivor benefits, you actually can claim off the ex-spouse even if you remarry, but that only is the case if you remarry after the age of 60. So yes, you have potential to claim off the ex-spouse. That's a little bit about Social Security. Obviously, one of the things that you should look at is your security statement. If you haven't seen them, just go to ssa.gov. You'll have access to Social Security statement after answering a few questions. You should start to think about what strategy, what commencement date should I look at. For those that might be 69 by the end of the year, you should be thinking about whether a restricted application makes some sense. And again, don't go this alone. It takes a lot of expertise to do this right. Make sure that you work with your financial advisor. So let's talk a little bit about healthcare and retirement, and then we'll wrap up our conversation for today. So that's obviously the other major governmental program involved in retirement, namely Medicare. Now, I don't know who lied to the American public, but if you go out and you ask Americans, about 40% of Americans literally come back and say they don't think there's any healthcare costs in retirement. Obviously, that's not true. It's estimated that Medicare only covers 60 or so percent of healthcare costs in retirement. And the number you're looking at here, I don't want you to dwell on it, but the number you're looking at here is from Fidelity. If you take a look at the reviewing healthcare and long-term care costs, essentially what Fidelity is saying on the left-hand side is that a 65-year-old couple needs 300 grand saved up. And they're not saying you need 300 grand to have a nice family. They're saying you need 300 grand literally as the kitty to pay healthcare bills in retirement. Now that actually uses relatively low assumptions on longevity and does not include a single dime of long-term care costs. So some may argue that it's a little bit lowball. But the bottom line is for the average American, healthcare is a significant expense in retirement, generally the second largest expense in retirement, second only to health to housing. And most folks, they're just not very confident about how they're going to manage their healthcare in retirement. And this is before we even get into the conversation of long-term care, which obviously can be a very big roadblock in our way to successful retirement. Now we're just going to talk a little bit of basics about Medicare. And really, if you look at the types of Medicare coverage, really Medicare can be bucketed into two main types. And it's actually kind of a first decision. The first decision with healthcare and retirement is, am I going to go the traditional route, what they might call the unbundled route? Or am I going to go with the newer, bundled or more commonly referred to as Medicare Advantage? And to be honest, it's getting pretty close. It was when I started in this industry, it was a very heavily weighted to traditional unbundled type of coverage. It's getting a lot closer. I think it's a little less than 60% these days go with the traditional route, and around 40% go with Medicare Advantage. But anyways, so that you understand it, the traditional route is enrolling in Medicare Part A probably around your 65th birthday. Purchasing Medicare Part B so that you have out-of-hospital coverage. The vast majority of Americans are going to want some type of prescription coverage. They're going to look at Medicare Part D. So these are all individual parts. And then most folks that we work with are going to say, well, I got Medicare Part A for hospital coverage. I got Medicare Part B for medical insurance, essentially mostly doctor's visits. I got Medicare Part D to help offset prescription costs. Doesn't feel robust enough to me. It doesn't feel like the type of coverage I had when I was working. So I'm going to start filling in the gaps and the spaces in that coverage by potentially looking at one of 8 Medigap or Medicare supplement plans. Now, like I told you, about 40% don't do anything. About 40% go what you might call the bundled route or Medicare Advantage. And essentially what we're saying here is, we have these insurance companies. They offer these plans, generally managed care, generally, HMOs and PPOs. And what it boils down to is people that retire today, that's pretty much all they have an experience with is HMOs and PPOs. And they don't see it a big deal staying with the insurance companies and staying in those HMOs and PPOs as they go into retirement. So as long as they're comfortable with that type of that's what Medicare Advantage or Medicare Part C is. And in some cases could be a significant savings, at least premium standpoint. Now, let's kind of break down each piece just a little bit. Medicare Part A, as mentioned earlier, is hospital insurance. Now, what's our premium for Medicare Part A? Trick question. As long as we paid our taxes during our working days, there is no premium. About 99% of Americans don't pay a premium for Medicare Part A. It doesn't mean you get to waltz in and out of the hospital without expense. There are deductibles over $1,500. There's per day co-payments. If you are in the hospital beyond 60 days, they're going to ask about $389 each and every day out of you. God forbid you're in the hospital after 90 days, they're going to ask about $778 each day out of you. Now, if you look at the hospital coverage that we have up here for Medicare Part A hospital insurance, this is specific to skilled nursing care. And don't get this wrong, there is no long-term care coverage in Medicare. What this is referring to, Medicare Part A hospital insurance, is if you need skilled nursing care after a 3-day acute stay at hospital. So understand there's a chicken and egg. You need to be in the hospital for a 3-day acute care. And then if you're in for the 3 days or more, and you go to a skilled nursing home, basically for rehabilitation, then there is coverage. And a matter of fact, for that skilled nursing coverage, you don't pay anything for the first 20 days. From the 21st to the 100th day, you paid about $194.50 each day. But after 100 days, that coverage stops, and you're going to pay 100% of the expense. So that's just a real brief concept of hospital insurance. Let's talk a little bit about out-of-hospital coverage, essentially doctor's visits, what they call medical insurance. Now, this isn't free, right? There's a premium associated with it. Now, here's some good news. The premium right now for the typical lower-income American is about $170.10. I don't know if you caught this in the media at all, but that's actually dropping. It's actually dropping for 2023 to about $165. So that's been unheard of in a number of years that I've been covering healthcare. So kind of a nice little change. But that's just the premium. You take a look here for higher income folks, you get significantly more for Medicare Part B. And again, it's not that you get to waltz in and out of doctor's offices without any expense. That's not true. The deductible is about $233, and you're going to have about an 80-20% sharing arrangement. So once you pay your $233 deductible, you're going to pay about 20% of the bill. Uncle Sam will pick up 80% of the bill. Now, obviously, as you look at this chart and how high these premiums could get at higher levels of income, managing taxation is extremely important in retirement. It can help stave off some of the Social Security tax that we're talking about. It can help stave off higher Medicare premiums. Might even just provide a better for you in general in retirement. Now, again, the vast majority of Americans would look at Medicare Part B, easy D drugs, right? It's prescription coverage. Now, understand it's not free. You're going to pay a premium for it. Average premium, about $40 or so per month. Remember, that varies a lot between region to region, parts of the country. It can vary greatly from parts of different states. But that's the national average. And what it does is it provides coverage, but it doesn't mean you get to buy all the drugs you want. There's no cost. That's certainly not the case. There is a deductible for Medicare Part D. It's about $480. And then you're in one of these sharing arrangements again. You'll pick up about 25% of the bill. Medicare will pick up the other 75%. So if you think about it, between the deductible and your share, the 25%, for the first about $4,400 worth of drug costs, you're paying over $1,200 of that first $4,400. So a significant chunk. After you get the first $4,430 worth of drug expense, then you end up in what they call a donut hole. Now, the donut hole is nowhere near what it used to be. It used to be a pejorative thing to say the donut hole. But right now in that donut hole, the reason people, don't like the donut hole is, you pay 100% of the bill, but you gotta account for the fact that there's been massive discounts negotiated. So these days, no matter whether it's a generic or brand name drug, there's a 75% discount that you're receiving. So essentially, you're paying about 25% of the freight. Now, the good news is, but I don't know, if you get the drug expenses of over 10 grand, is good news. But if you do, you have drug expenses of over $10,012.50, then you get the catastrophic coverage, and essentially you pay 5% of the bill. 25% goes to the government for them to pay. Now, again, very interesting. I don't know if you paid attention to the Inflation Reduction. A lot of that was not a lot concrete for us. But one thing that came out very concretely from that Inflation Reduction Act is by the time we get to 2025, the maximum that we'll pay out of pocket for prescription costs will be $2,000. That is much better than obviously the world that we're looking at here. Now, obviously, if I have Medicare Part A, hospital insurance, Medicare Part B, medical insurance, even bought Medicare Part D prescription coverage, I still might not be happy with the level of coverage. I might look at one of the 8 Medigap plans to start filling in those holes and those gaps. Please understand, even if you have A, B, D in a Medigap plan, there are still things that won't be covered. There'll still be big gaps in drug coverage, no dental, hearing, vision. So just understand that under traditional Medicare, there still will be significant out-of-pocket costs. Now, this is maybe just one way to kind of sum things up, and then we'll wrap up our time here today. And that is, what does the overall cost look like on average? So if we look at total Medicare cost, the example for 2022, what we're looking at here is this kind of average lower income individual. What can they expect from Medicare? Because I don't think that $300,000 figure for Fidelity is all that helpful. But maybe what's more helpful is try to figure out what the average expenditure would look like for a typical 65-year-old. So we kind of run through it. Do we have a premium for Medicare Part A? No, 99% of Americans don't. As long as you pay your taxes, you don't. So there's no premium cost for Medicare Part A. If you annualize Medicare Part B premium costs, assuming you don't have higher levels of income, about $2,000. Medicare Part D, country average, would run you a little over $500. That Medigap plan, country average again, would average about $3,000. A good estimate for out-of-pocket expense would be about another $2,000. If we kind of totaled it all together, the average cost for a 65-year-old, healthy 65-year-old, would be approaching $8,000, about $7,700 to $8,000. So what that's telling you is, if you're looking at a couple, you're looking at more at $1,500 to $1,600. So anyways, that gets you a feel for a little bit on Social Security, a framework to think about there, a little framework to think about healthcare costs in retirement, which I hope that you find to be helpful. So again, I know that we wanted to keep this to 45 minutes. So I'm going to close there. I do want to thank you for your time here today. Greatly appreciate it. Hopefully you found it helpful. And what I'll do is I'll turn it back to you, Andrew. I don't know if I left enough time for Q&A, but I'm certainly glad to do it if we do have the time. So Andrew, I'll turn it back to you.
All right. Thank you, Steve. Well, with people not being able to use audio, if you have any questions, feel free to put it in the chat. For those of you who do not have any questions, thank you for joining us. And again, this webinar will be recorded and will be sent out. And if you have any questions at all, and you don't want to put it in the chat, you can feel free to reach out to us directly, and we can set up some time to speak more on these topics. So we'll just hang out here, Steve, just for a little bit.
Yeah, sounds good.
No questions yet. We got 15 people still on. We'll give it another minute or so.
Sure.
All right. Well, thank you again, Steve. And for those of you who are still on, thank you again for joining us, and have a great rest of your day.
Glad to do it. Have a great rest of the afternoon.